A quick disclaimer before we begin, the PEMF podcast does not contain any medical advice, and the content provided is for informational purposes only. If you have any health concerns, please visit a healthcare professional. So welcome back to the PEMF podcast.
And today we're going to be talking about pain and inflammation. Probably a little bit of an overdue episode, as this is kind of one of the most common uses for PEMF. But you might be brand new to PEMF, and this might be the first time you ever listened to the podcast, but you saw the title and you wanted to know how to reduce pain. So maybe just quickly for those people who are new, what is PEMF?
So PEMF therapy is, it stands for pulsed electromagnetic field therapy. It's all about creating a magnetic field that passes through the body. It creates an environment within the body to quicker heal.
Okay, great. So how do these magnetic fields then have an influence on the body to help it kind of reduce pain?
So the pain reduction side of things, it's important to know how PEMF therapy works, as in what we're trying to do with PEMF therapy is fix the cause of the pain. So when we look at things like TENS machines or even like a painkiller, we are either using a TENS machine or we're using a painkiller. We're taking a painkiller to basically turn off that pain. Not the same process as with PEMF. What we're trying to do is find the source of the pain, heal it, and reduce that pain permanently.
So you said there you're not just trying to block the pain with PEMF, you're actually trying to heal it. How does this actually happen? Like what's going on in the body? Like how is this happening?
So there's a number of different processes within the body that is happening as a result of these pulse electromagnetic fields, one of which is modulating the nerve activity. So PEMFs can actually help modulate nerve activity through disrupting pain signals. So I know I said that we're trying to fix the cause of the issue, but at super high intensities, PEMFs can actually also help block nerve activity. So you're getting an immediate effect on pain rather than just pain from a pain reduction from the cause of the issue being fixed. So there is a degree of that too, but the other ways in which PEMF therapy and the results of that is going to be releasing endorphins. So there's also the anti-inflammatory effects. So if we can reduce the inflammation in the area, again, that is going to be something that is going to help reduce pain. We can enhance blood flow with PEMF therapy. So if we can increase the circulation, we can increase the oxygenation in an area. There's also relaxation in muscles, which is going to help in areas where the muscles are tight. Reduction of edema. PEMF therapy has also been shown to reduce edema, which is the accumulation of fluid in tissues. So if we can reduce that, again, byproduct of that, less pain, and the promotion of tissue repair.
So now we actually know what's going on in the body and like kind of how PEMF reduces pain. How would you apply PEMFs to do this?
So again, you've got a full body mat or you've got a localized applicator. We do recommend, if people are treating pain, even if it's just localized to the knee or something, we still recommend the full body systems. So all those different things that I just mentioned in there with circulation, we want to have a systemic effect on the body as well as targeting it in a certain area. So if you can find a PEMF device that has a full body mat, but also intensifies it on a localized applicator, then for pain, that's the ideal situation.
Okay, so now they know they kind of need to look for a full body mat with a localized applicator. More into the specs, is there like an intensity maybe that you would look for, or maybe more of a minimum intensity you might look for?
So intensity when it comes to pain, actually super high intensity devices, as I mentioned earlier, can actually have a bit of a nerve activity modulation. So if you're going for a device that is like in the 1000 Gauss range and above, then these tend to have a little bit more of an effect on pain immediately than the lower intensity devices. But again, as a complete package of PEMF, what we're looking to do is fix the cause of the pain. And if we could do that within a week or two, then that pain reduction is going to be beneficial either way.
So now we have the intensity side. What kind of frequencies would you be looking for on the device?
So frequency-wise, again, we're treating pain. We don't know what the cause of the pain might be. Pain is a symptom. So depending on what we're trying to treat, PEMF therapy isn't condition specific. As I mentioned before, it's all about creating an environment in the body to heal. So frequency, again, if you're using the therapeutic ranges, it hasn't got as much effect, I would say, that intensity has when it comes to treating pain.
Okay, great. So is there any other specs then as well that people might need to kind of bear in mind, maybe polarity or anything like that?
Not particularly. It's just my main thing would be get a decent device. Find a device that has something that is, in my recommendation, something over 30 Gauss with the full body system. And if you're looking at a localized applicator, something that has an intensity of a minimum of about 100 Gauss and above. Those devices are going to get you some instant results as quickly as possible, and you're going to get a good spread within the body. If you can find a device that has multiple coils within a full body system as well, because although some devices supply a full body mat, they may only have 1 or 2 or up to 4 coils in those. Look for systems that have a good spread of coils, minimum of 8 up to about 12 and more, just so that you're getting a good spread of the PEMF therapy across the body, because as soon as you move away from them coils and away from the applicators, you do lose intensity pretty quickly.
So we've kind of already touched on this part just a little bit, but just to kind of re-clarify for anyone, how often to kind of see these pain relieving effects are you going to have to use the devices? Is it like a daily kind of thing? Can you use it once a week, once a month? What's the kind of the time span?
So with pain, we always ask people to take a pain diary, especially if you're using a low intensity device. But normally within 2 weeks, people will notice quite a big difference, quite a significant difference in pain scores, providing they've been using the device religiously, they've been using it either once or twice a day, and they've been using it to the right protocols. Usually 2 weeks is that golden point for me that I tend to touch base with customers and find that they are starting to get a reduction in their pain score.
Great. So with a lot of other kind of pain medications or pain related kind of reduction methods, you might kind of see side effects come along with them. Are there any side effects that come along with PEMF?
So the simple answer to that is that there's no known side effects. There's risk with using PEMF therapy that with things like pacemakers, it's advised not to use PEMF therapy when you're pregnant. But again, these are more about the unknowns.
So now we've kind of covered everything to do with pain. People might now be going, you said pain and inflammation at the start. Where does kind of inflammation come in all of this?
So it's a good question because, one of the main causes of pain is inflammation. If an area is inflamed, your body's going to be sending those pain signals to, it's a response from the body to heal that area. PEMF therapy affects the body at a cellular level. So what it does with those cells, it helps to positively charge those cells, which is going to let nutrients in the cells and waste materials out of the cells better. So just that process is helping to modulate those cells and reduce that inflammation. There's a modulation called cytokine, which basically is affecting the secretion of cytokines. It's a key regulator of the immune response and inflammation. So by modulating those cytokine levels, PEMF therapy can help to dampen the inflammatory response. So it's kind of dampening your body's ability to chuck a load of inflammation down at that area. Another byproduct of PEMF therapy on the body is the nitric oxide production. So if we can increase the production of nitric oxide in the cells, that is a molecule that is involved in different physiological processes, including the regulation of inflammation. So again, if we can increase the nitric oxide production within the body, that's going to help reduce the inflammation. Lastly, really, it's the regulation of the ion channel. So PEMF therapy may actually influence the cellular calcium levels, and actually those calcium levels play a crucial role in inflammation and the immune responses. So if we can reduce those, we can stop again a huge amount of activity within the inflammation.
Great answer. Hopefully that has kind of helped everyone fully kind of understand the effects that PEMF has on pain and inflammation in the body. We've got a little bit more sciencey in this episode than we kind of tend to like to. We always like to keep it as simple as possible, or kind of as simple as you can keep it. So it's as easy to understand as it can be. But if you did get a little bit confused, or you do just have any questions about PEMF in general, please make sure to leave them below wherever you're listening from, and we'll make sure to answer them in our next PEMF Talk episode, which is a little mini series we do where we literally just answer your PEMF related questions. But while you're down there, if you haven't already, make sure to leave us a follow and drop us a 5-star review on whatever your platform you're on. It just helps us get bigger guests and makes the episodes better every single week.
Thanks again for listening to another episode of the PEMF podcast.